Atrial fibrillation is actually sometimes a hard cardiac disorder to diagnose, because the earliest stages of atrial fibrillation are just that, something called paroxysmal, which means they do come and go. And these are patients who may experience atrial fibrillation once a month, once every 6 months, or once a year. Unfortunately, the rate at which you have the frequency with which you have atrial fibrillation doesn't necessarily correlate with the risk of stroke or other complications of atrial fibrillation. The natural history of atrial fibrillation is to begin as paroxysmal once in a while and progress to a persistent form over time. And this makes it tricky for doctors sometimes to pick up atrial fibrillation, because a patient may complain of certain chest symptoms and go to their doctor, and the doctor gets an electrocardiogram, and the time that the patient is in the doctor's office, they're actually back in a normal sinus rhythm. So these are patients who might need extended rhythm monitoring to be able to pick up the AFib, and it is extremely important for us to pay attention to these intermittent symptoms and not treat them like the patient is just simply having anxiety or symptoms that are not relevant to any important cardiac disorder, especially since atrial fibrillation is known to be so common in society.